CataractCoach.com, ECP, Endoscopic Cyclo-Photocoagulation. This is treating glaucoma at the time of cataract surgery by using a laser to cause cyclo-destruction. So here's the patient, just had cataract surgery, eyes full of viscoelastic, IOLs going in the capsular bag, and now with the IOL in the capsular bag and the capsular bag and anterior chamber full of viscoelastic, we can get towards doing the ECP. Now, first thing is let's expand the sulcus. So some viscoelastic going in, use a cohesive agent, even a super cohesive agent would be good, just to give yourself more room there. So inflating the sulcus area. And there's the lens there, plenty of viscoelastic. Now, before we do this and get the laser ready, let me tell you that on CataractCoach.com, the website, do you know there's a free PDF book about cataract surgery? You can have it. There's a free 25-part curriculum series. There's our podcast. You can sign up for our daily email. A lot of good stuff. Here comes the laser. Now, the laser is not just a laser. It also has a camera and a light source. And so once you get this in there, you're going to try to ablate the ciliary processes. So the laser goes in the eye here. Nice if you can set up the camera a little bit. And the laser has an endoscope on it so you can actually see what you're doing. And you can control the laser delivery with a foot pedal. And your goal here is to ablate or basically damage cyclo-destruction of the ciliary process so they make less aqueous. And so therefore you lower the pressure. So here you can see there's the view. Get the endoscope in a little bit more. And you need to find, that's the iris. So go underneath. There we go. Let's find the ciliary processes. There we go. Now you want to be about 2 millimeters away from the ciliary processes. And you can tell if you see 7, 8 of these ciliary processes in your view, you're too far away. If you can only see 2 or 3, you're probably too close. So probably aim to see, a few of them there. Now, when you deliver the laser energy, you're delivering it so that you cause this whitening here of the ciliary processes. And you want to go around as much as you can. From the main phaco incision, you could probably hit 270 degrees or so. Sometimes using a curved tip on the laser can give you a little more reach or access. You can also do it with 2 larger paracenteses, 180 degrees apart. So you can see there's the laser being delivered, and this is going to cause cyclo-destruction, so it'll produce less aqueous so you can lower the pressure. Now you can also do this via pars plana approach if you're also doing a full pars plana vitrectomy at the same time, and that may even give you a little bit more advantageous angle. And you can imagine it's very hard to do this, and nearly impossible when the patient's phakic, trying to do it from the anterior like we're doing here. But a pseudophakic patient, at the time of cataract surgery, this is a very nice procedure. You can see staying about 2 millimeters away, and so delivering that energy, and you can titrate it. This is usually about 810 nanometer wavelength. And you can see once these are whitened like this, that's all you basically need to do. Now, there may be more post-op inflammation in these patients, so you may need to treat them with more corticosteroids, either topically or intracamerally for a little bit longer. But you can see now, that's a good view. There we go. So I like this picture-in-picture view, and that's very close to the processes. And once you've done it here, I think you're about 270 degrees worth, that should have a pretty good effect. Now, you can do full 360, but again, you probably want to make 2 a little bit larger paracenteses about 180 degrees apart from each other. And so you can see going to the subincisional area is very difficult. You got a lot of torque there on the incision trying to get there, and that should really do it. So now the rest of the case can be finished, so we'll speed up the video here. And so at this point, of course, the rest of the surgery is routine. We're going to take out the viscoelastic from the eye, seat up the incisions. And again, a patient with a glaucoma, you probably do want to do, like it's shown here, do a monofocal lens. When you have a compromise of the optic nerve and the nerve fiber layer, a monofocal lens is probably your best friend here. And so sealing up the incision, nice looking rhexis too, beautifully centered lens. And looks like a single piece acrylic lens. And seal up the para. And again, you may want to put this patient on a little bit more steroids in the post-op period to help quell that inflammation. So in our complete library on Cataract Coach, now we have a video about ECP, Endoscopic Cyclo-Photocoagulation. And I got to remind you, the Cataract Coach website, so much good information there, the free Cataract Coach PDF book, curriculum series, our email of the day. Check out our podcast. We're all over social media, especially check out that Instagram, growing fast and very popular.